Good afternoon, everyone. I'm Shana Varner with PHCA. Thank you for joining us for today's webinar, Behavioral Health Services for the Nursing Facility Population. A few updates before we get started. This webinar is being recorded and will be made available on the PHCA website and will also be shared with OLTL, LeadingAge PA, and PHCA. Webinar has been approved for 1.5 continuing education credits for all attendees. For those who provided a NAB number, credits will be uploaded within the next 2 weeks, and we'll also be sharing certificates with you later this week. Following today's webinar, you'll receive a survey. As a reminder, your feedback is very important to us and our presenters, so we hope that you'll take a moment to complete the survey at the end of today's webinar. As we begin, all attendees will be in listen-only mode throughout the presentation. Please feel free to submit questions via the chat box on your screen, and we'll make sure that we ask those questions at the end of today's presentation. Today's webinar is presented by subject matter experts with connections in behavioral health services for nursing facility residents from across the Commonwealth. We found that the collaboration with OLTL and behavioral health services to be very important for skilled nursing providers across the state, and we're hopeful that this webinar will help to familiarize you with valuable and often underutilized behavioral health services available to you and to your residents. I'll now go ahead and turn today's webinar over to Jami Buckenhauer, Deputy Secretary with the Pennsylvania Department of Human Services Office of Long-Term Living.
Good afternoon, everyone. Thank you so much for your attendance. I'm so glad so many of you are participating for education or just for a refresher on this important topic. As they said, my name is Jami Buckenhauer, and I do have the honor of serving as the Deputy Secretary of the Office of Long-Term Living. The Office of Long-Term Living does oversee the Community HealthChoices program and is responsible for the training and communication regarding the transition of our previously fee-for-service model to managed care. And it was at that point when we were going through the transition to a managed care platform into Community HealthChoices that the Office of Long-Term Living really worked hard to put together education and training for nursing facilities, letting them know how a new population, those that were receiving our aging waiver and those that were in nursing facilities, now had access to Medicaid behavioral health services. And they were enrolled in the Behavioral Health Choices program. So at the point of transition, the Office of Long-Term Living did a lot of education and training. And obviously, it wasn't just nursing facilities. We educated our managed care plans, providers, stakeholders, families, and those in facilities about these new benefits that were available through Medicaid to individuals in nursing facilities, how to access these services, and what services they could receive. However, at the conclusion of the implementation of Community HealthChoices, we ran into a pretty significant stumbling block, and that was the COVID public health emergency. Obviously, for the past 2+ years, nursing facilities, as well as many of us in state government and actually just many people in the general population, have dealt with the planning, preparation, and dealing with outbreaks and subsequent workforce shortages. They have really occupied all of the work that we've been doing for the past 2 years. I just want to take this opportunity right now to thank the nursing facility staff for all of the work that you've done during COVID. We know it was so important, and we appreciate your focus on keeping your residents safe at that time. But coming out of COVID, hopefully, I'm saying hopefully we're coming out of COVID, we know that residents as well as others have significant behavioral health issues that were probably, I want to say, amplified during the COVID public health emergency. Our goal with these webinars, and obviously with this webinar today, is to provide the information to assist nursing facility staff in connecting your residents with the care that they need, the behavioral health care they need and they have access to, we think it's obviously so important. So anything that we can do to educate the staff and nursing facilities on how to access behavioral health services for those residents you have in your facilities is critical right now. At this point, I'm hoping to turn it over to Kristen Hauser for some additional welcoming remarks. Kristen, are you on the phone?
I am on and finally able to unmute my microphone, so thank you. Sorry for making people worried earlier. I just couldn't get that little red dot to go away. So good afternoon, everybody. I'm Kristen Hauser, and I'm the Deputy Secretary for the Office of Mental Health and Substance Abuse Services. Our office oversees behavioral health care that is supported through the Behavioral Health Choices or Medicaid funded behavioral health services in the state, as well as county run services for individuals who are not enrolled in Medicaid. So more or less the publicly funded side of behavioral health. And when Community Choices was implemented, it really presented a new opportunity to provide expanded access to mental health care for adults who were residing in nursing facilities. I know that advocates in the behavioral health arena were really enthusiastic about the development. They are eager to hear how it is going and ask us frequently for updates. And I think it's important to note that our country is aging and healthcare has improved, which means many people are living longer lives. And the outcome of that could certainly be that adults who are living in nursing facilities are likely to, the numbers are likely to continue to increase, and so will the behavioral health needs of those adults. Mental health care is health care, and it's important that we are actively creating linkages and supports for adults who need behavioral health care so that mental health needs and substance use disorders and other behavioral health needs can be met no matter where they reside. While the awareness that older adults often have mental or behavioral health needs has been growing in general, it's impossible for us to now overlook just how the pandemic has impacted people. And I think, frankly, I know I'm preaching to the choir in that regard. The past few years have really exacerbated the need for mental health supports for many people of all ages. Factors such as simply being at higher risk of serious health outcomes if the virus was contracted due to nothing other than age alone certainly increased the sense of fear and uncertainty and trepidation about trying to go about daily life for many older adults, my own parents included. It's been interesting to watch how so many other parts of my personal life have sort of been going back toward normal. And then I speak with my parents who are in their late 70s, and the amount of caution and hesitation that is being exercised really is still very, very present because of those fears. So the need to mitigate the spread of the virus definitely resulted in an increased sense of isolation for many individuals, particularly those who were residing in congregate care settings. And then when outbreaks occurred, facing real dangers, as did many of you, really can have an impact on your sense of well-being and ability to, protect your own safety and predict your own future. So given all of that, we're really pleased that we are partnering with the Office of Long-Term Living to provide this overview of behavioral health services so that you know what kinds of care are available, how service coordinators can make linkages to behavioral health care providers, and just be our partners in supporting the emotional and behavioral well-being of the residents that you care for by helping them access needed supports, things that will benefit quality of life for them, the quality of your work environment for you, and promote the value of wellness throughout your facilities. So thank you very much for spending time with us this afternoon. And I will turn it back over to review today's agenda.
Good afternoon, everybody. My name is Kelly Meinzer, and I am the Director of Operations at the Office of Mental Health and Substance Abuse Services. And today, as part of our presentation, we have some points of discussion and question and answers. And we kind of put these out there, we're going to put these out there to kind of have everyone think about possible questions to start thinking about what kind of questions you might have. And the first question moving forward is, what are the top 3 behavioral health training topics for nursing facility staff that you think would benefit your facility? So think about that as we go through the presentations. We ask that everyone, as said and stated at the beginning of this, that you type your question into the chat box, and we'll try to answer as many of these as we can at the end of the presentation. But moving forward, we have the behavioral health managed care organizations. I'm going to talk a little bit about some of the steps and processes they have taken over the last couple of years since the initiation of CHC to outreach to those individuals and workers in nursing facilities as well as the community. But first, I'm going to turn it over to Duncan Bruce, who is, I'm sorry, not Duncan Bruce, my mistake, Joe DeMayo, who is the Behavioral Health Coordinator for Community HealthChoices at CBH. So Duncan is going to go, excuse me, Duncan did it the last time, I apologize. Joe is going to briefly describe behavioral health services that are available to those individuals in nursing facilities. Again, I apologize, Joe.
Thank you, Kelly. I guess this was my idea. We would take turns, and it's my turn this time around. So, hello, everybody. I'm Joe DeMayo from Philadelphia Community Behavioral Health. And as Kelly stated, I'm the Behavioral Health Coordinator for Community Health Choices. But today's presentation, I'm representing the 5 behavioral health managed care organizations across the state. Just to give you an overview of behavioral health managed care organizations, the services that are available through the Health Choices and the Community Health Choices programs. So as you all know, Pennsylvania is what we call a carve-out state. This is a state that has behavioral health carved out of Health Choices. So Health Choices, as you see in the slide, is Pennsylvania's managed care programs for medical assistance. So behavioral health is carved out of that, and through behavioral health managed care, people with Medicaid receive quality medical care and timely access to appropriate mental health and or drug and alcohol services. As Kelly explained and Kristen explained earlier of OMHSAS, they are the overseer of all behavioral health services. With Community Health Choices, when that rolled out in 2018 and 2019 in Philadelphia, Community Health Choices added more individuals to our enrollment due to the dual eligibility. So, and individuals who were on the aging waiver and individuals who were residing in long-term care facilities and nursing facilities. So we were able to develop services for this population that is actually new to the behavioral health managed care organizations. Okay, next slide. So a little bit about the history. The Mental Health ID Act of 1966 established these county-based service systems. As I said earlier, the Office of Mental Health and Substance Abuse Services, OMHSAS, oversees all the behavioral health choices programs. OMHSAS has funds for the county governments for the provision of these services. And we work in collaboration with this county, with OMHSAS, and with all the providers in our networks. Health Choices Behavioral Health, Medicaid managed care started in February of 1997, and actually that's when CBH was created in Philadelphia, and we are 25 years old this year. So behavioral health is a part of an integrated human services model in Pennsylvania. As Kelly stated earlier, behavioral health care is healthcare. And we cover mental health conditions, substance use disorders, and some developmental disability services as well. Behavioral Health Choices is operated under direction of the counties. CBH is under the Department of Behavioral Health and Intellectual Disability Services of Philadelphia, and that is the county that we reside in. And now the other counties have the other behavioral health managed care organizations working out of each specific county. The company that manages behavioral health needs will depend on, as I said, the county in which you live. Medicaid is the payer of last resort for the folks that have Medicare primary. With Community Health Choices, this is new to many enrollees of Community Health Choices. If they are Medicaid and Medicare, of course, Medicare is primary, but the Medicaid services will cover the secondary or last payment of behavioral health services. There are some services which you could go to the next slide, which we cover that Medicaid, Medicare does not cover. So some of these services I'll explain a little bit later. But in the state in-plan benefits, all behavioral health managed care organizations must cover these services. So all these services here are available to anybody that is residing in a nursing facility. Okay. Some of the identified services that we really are pushing into the nursing facilities since Community Health Choices are peer support services, mobile mental health, as well as, of course, telepsychiatry since the pandemic began. But some of these services will really enhance the services that people could get in a nursing facility. Okay, so the next slide. Okay, some of these other services, what we call supplemental services, are additional services beyond the ones that were in the last slide. So a lot of services could be specialized to each county. There are other services which are more specific to the specific needs of individuals, depending on the county, depending on the providers in the networks. So get to know your behavioral health managed care organization. Really, that's the goal. Our goal is to let you know that services are available to your residents, that the behavioral health managed care organizations in your county can assist you with all behavioral health needs, answer questions. Each one of us has a member services line that you could talk to people if you have questions. And it's really important that you reach out to them for other help. As you know, with Community Health Choices, you talk to your service coordinator, and sometimes you could just reach out to the behavioral health managed care organization and get some answers too. Okay. These are the 5 behavioral health managed care organizations across the state of Pennsylvania. As you can see, Beacon Health Options, Community Behavioral Health, Community Care Behavioral Health, Magellan, and Perform Care. And as you see, the counties, this is a state map to see where every body is located. Okay, so what we could do, how to get started. As I said, we all have staff that can answer your questions. We all have member service numbers. We all have different networks throughout our behavioral health managed care organization. We have providers that could work with you, and we have specialty providers as well. So please take advantage of it. And as I end this part of the presentation, I'm going to talk to you a little bit about community behavioral health and what we have accomplished in Philadelphia since Community Health Choices began. So community behavioral health is, as I said, is the managed care organization for Medicaid population for the city of Philadelphia. We also have over 700,000 enrollees in community health and community behavioral health. We've added more since the beginning of Community HealthChoices. As I said, individuals living in nursing facilities and individuals who were previously on the aging waiver are now enrollees with community behavioral health. We have over 200 providers in our network who could provide all levels of care throughout all populations. So we have plenty of providers in our network who could assist in different specialties. Since the beginning of Community HealthChoices, we have encouraged nursing facilities to reach out to us. We reached out to nursing facilities and we allowed them to identify the needs that they have. We have many providers who have worked very closely with us to provide mobile mental health therapy, to provide peer services for residents. Of course, a lot of things changed since COVID, but they are still available. One of the other goals that CBH has done is to push in training opportunities for nursing facility staffs. We've had 4 or 5 nursing facilities in the city that have taken on mental health first aid certification training for all of their staff and employees. This is done, it's a federal program, but you get a certification in mental health first aid. Right now, they are all virtual and they're still being offered throughout. We also have crisis management services available. We have residential type services, and our newest training that we're offering this month is Narcan training. So as Governor Wolf sent out a memo recently about the number of opioid deaths among older adults has risen. So we're taking advantage of how we can help in that. But if you are on the call and you are a Philadelphia provider of long-term care, please keep this number handy, and I will say it, 1-888-545-2600. This is our member service line. It is operational 24/7, and you will always speak to a live person. So any questions you have around behavioral health, around services, or just any other questions you may have, they will assist you. So I want to pass it on to my colleague from Beacon, and that's Rachel. And Rachel will talk a little bit about Beacon and how they've worked with Community HealthChoices in nursing facilities. So I thank you all again, and take care of yourselves.
Thanks, Joe. Hi, everyone. It's Rachel Lee Price. I am a manager of behavioral health clinical services at Beacon Health Options. Just to give a few examples of what Beacon does to try to make sure connections are made with residents for CHC. We did send surveys to nursing facilities way back when the rollout started to try to assess needs, sort of introduce ourselves. We followed up to obtain further data regarding potential unmet needs. We did this in coordination with our account executives and primary contractors for the nursing facilities located within our network. We also coordinated and conducted county-specific behavioral health 101 trainings for nursing facilities. The presentation included information on in-plan and supplemental services and how to access both BH and substance use disorder services within each county. I did those presentations either via webinar or we did go in person. We're always willing to connect and do such a discussion again. And then we also attended and presented at several forums where nursing facility associations and members were in attendance. So if anybody needs anything from me, my contact information is listed, and then I will go ahead and pass it off. I believe, I can't remember who's next, Kelly. Let's see.
Let's pass it on to Lauren Keane.
Thanks.
Hi, this is Lauren Keane. I'm Director of Integrated Health at Magellan. At a minimum annually, but often twice a year, we start outreach efforts to the nursing facilities in our areas where we know we have residents, asking if they feel that they have enough of behavioral health supports in place, if they're happy with the behavioral health provider that they're working with, looking for opportunities to provide extra supports. We've offered trainings like Behavioral Health 101, level of care trainings, and making connections in general to other community supports as appropriate. We've surveyed our provider network to identify providers who have experience working with the older adult population that would be a possible contact for any nursing facilities who are looking for either additional supports or a new provider in general. And since obviously beginning of CHC, we've also contracted with several providers who work exclusively with nursing facilities, and over time have sought feedback from those providers on where they're seeing the needs, what trends, what supports are needed most, and so on, just so that we have an understanding of where those needs are and opportunities for the future. Obviously, we've done regional trainings, gone to some of the association conferences and the stake calls, and provided Magellan's provider networks education. We've been engaging the ombudsman offices and crisis programs to identify needs for the Community Health Choices population, and also specific nursing facilities, and then connecting where appropriate with crisis support programs in the area, whether it be for crisis trainings or behavioral planning needs on individual members, and so on. And then more recently, I would say in the past year, we've been building some connections with the nursing facilities that we've been able to connect with, offering them certified peer specialists, and making those connections to specific providers and helping start that process so you can get the referral workflows set up and started. So just a few of the things that we've been working on. And I think next, I believe it would be Perform Care.
Hi, this is Kelly again. I do not see a representative from Perform Care, so something must have come up today, so I apologize for that. That would be Dan Eisenhower. I can get his contact information and put it in the chat box. So I believe Duncan Bruce is the only one left from the behavioral health side.
Great, thank you, Kelly. So let me just take a second to introduce myself. I'm Duncan Bruce. I'm the Director of MCO Integration at Community Care Behavioral Health. Community Care is one of the 5 behavioral health MCOs that operate in Pennsylvania. We actually cover 41 counties across the state, and we've been involved in all 3 phases of the CHC implementation, dating back to 2018. We currently have about 1.2 million members. We have sort of 11 regional offices where we have staff that sort of work in and about the different communities where the offices are at. So I'm going to just quickly go over some of the activities and things that we've done over the last couple of years to support the implementation of the CHC program and to sort of advocate for behavioral health, especially in nursing facilities. So as the Community Health Choices program rolled out in the different phases, we actually called each individual nursing facility as the sort of phases implemented, and offered to either do in-person or telephonic meetings where we did sort of a sort of behavioral health 101. We did survey nursing facilities across all of the counties that we operate in to find out what particular behavioral health needs that they may have or training needs. A couple other things we've done, we did sponsor mental health first aid training. We did that in partnership with one of our counties. We also sponsored a certified older adult peer support specialist training, which is essentially a certified peer support program that specializes in working with older adults. We've offered lunch and learn for nursing facilities. The last 3 or 4 years now, we've had either an in-person or a web-based training series really geared towards behavioral health, and sometimes specifically the unique needs that nursing facilities may have. On our website, we have a lot of specific behavioral health materials geared towards the CHC population. We have a Behavioral Health 101 training and some other materials. We participated in lots of panel presentations and discussions, especially quite a few of those sponsored by the trade associations. I'm trying to think of a few other things. When COVID began, we did work with all of the other behavioral health MCOs to come up with some different materials and ways that we could support everybody. And sort of the last thing I mentioned is too, we also participate in the CHC partnership meetings, which take place quarterly across the state, which heavily focuses on really touching base with nursing facilities and the HCBS providers to continue to educate folks about behavioral health and what the behavioral health MCOs can offer. And Kelly, I don't think I have any else to hand it off to, correct? Because Dan's not here.
Correct. Again, thank you, everybody. And I wanted to move again to some of the questions, just to kind of spur some thought after these presentations. What are some behavioral health services that have been most helpful to your nursing facility? And then what behavioral health service do you currently need that you do not feel that you have adequate access to? So think about those as we move forward, and you can put your information, your questions or thoughts in the chat box, please. And now I'm going to give this over to John McFarland, and he can introduce himself from the Community Health Choices side of things.
Thank you, Kelly. Yes, my name is John McFarland. I'm the Director of MCO Integration at UPMC Community Health Choices. So on the managed care of Community Health Choices, we're working more with the long-term service supports. We do not directly manage the behavioral health benefits, as my colleagues, the BMCOs, have explained. It's in coordination with them and with the Medicare plans. However, we do assess and ask each in our own ways behavioral health needs and develop a plan around that. So there was some questions to OLTL from some nursing facilities, and respecting that each nursing facility organizes their behavioral health a little bit differently. Some of you have a full team of professionals already working with you or have a contract. Others already have an identified provider, a therapist, psychiatrist, whereas others are sometimes still struggling to access services. So rather than get bogged down on what assessments each plan uses and trying to get you to memorize all sorts of acronyms, we want it to be practical. At the end of the day, our service coordinators are getting this information from the participants, the residents, as well as your own nursing facility and minimum data set. And so we want to bring your attention more to what sort of symptoms we need to look out for, because assessments roughly cover the same things. That sometimes the concern is what already seems to be normal or expected in nursing facility residents, or explained away by maybe it's medical issues or medication and not as easily detected. And also ageism can sometimes be a factor. So I'd say adjustment disorders could reflect as sadness, boredom, or disrupting behaviors in people who are trying to sabotage their stay at the nursing facility so that you have to send them home. Depression obviously can be sadness, but loss of pleasure, sleep issues, too much, too little, problems with concentration, decreased appetite, increased appetite, changes in activity, talking more about death. These could all be signs of depression. Anxiety, avoidance, avoiding people, avoiding things, topics, hoarding, preparing for something, sudden agitation, and repetitive behaviors can all be symptoms of anxiety. Psychosis, describing odd perceptions, could be a symptom of hallucinations, on the lesser side, just starting. Feeling of persecution, everybody's out to get me, could be early onset of paranoia. And substance use, which most nursing facilities have a handle on not getting any substances sneaked in, but sometimes people do trade medications or have a little bit too friendly visitors who sneak stuff in. So intoxication-like symptoms that are not accounted by medical diagnosis and not responding to treatment. So if your resident looks like they're high or drunk, maybe it could be dehydration, could be an effect of being on 16 different medications, or maybe they are abusing something. So these are just things to consider, bring forward to your PCP, to your main doctor, your facility, anybody else involved in their care, and sort of just ask, could this be behavioral health, and start thinking about coordinating and offering services to people. We have heard from residents that many of them do like talking to somebody and connecting to more services. So with that, I will turn it over to my colleagues from PA Health and Wellness. Do we have anybody on from PA Health and Wellness? Right, I know our main contact was unavailable today. Well, if need be, I can cover. The other question is how to access behavioral health services. We try to keep things as simple as possible on the CHC side, as the main point of contact being service coordinator. It doesn't have to be the only door to access treatment, but usually going through a service coordinator can help simplify a lot of processes, and then we can coordinate internally and reach out to all needed parties. And we did want to note that we already have an established psychiatrist and therapist. You do not need to change providers, save for any sort of disruption in network status. And please notify the service coordinator so they can put this into the record and to the person-centered care plan, so we're aware of this. So I will turn it over to my wonderful colleagues at AmeriHealth Keystone.
Thanks, John. Is everyone, I'm guessing everyone's able to hear me okay. This is Sarah Reitnauer. I'm the manager for collaborative services at AmeriHealth in Keystone, overseeing behavioral health coordination as well as access to nursing home transition. So we wanted to talk a little bit about what should happen if there is a behavioral health need that should be addressed or needs to be addressed during nursing home transition. So it's critical that these needs are addressed as early as possible. If there is a behavioral health need that's addressed in the facility while the person is a resident at the facility, we need to plan for that for when the participant is discharged to the community. This could include behavioral health medications. I know sometimes individuals will say that a person is not receiving behavioral health services in a facility because they think only of counseling services, but behavioral health medications is actually considered a behavioral health service. So if someone is in a nursing home and they are planning on transitioning to the community and they are on behavioral health medications, this needs to be planned for. Some medications are able to be prescribed and to be monitored by a PCP. So if that's the case, then we can go ahead and plan for that. However, some medications are such that PCPs are not comfortable with that, and wait lists for psychiatric care in the community can be quite extensive. So it makes it important that we plan for that and that the nursing facility and service coordinator collaborate to coordinate and plan for that need in the community, to do so well in advance of the transition so that we can make sure the person is lined up to see a psychiatrist once they do transition. For behavioral health therapy, if someone is receiving that in the nursing facility, the facility should work with the service coordinator to notify them of those current services that they are receiving in the facility. That can help the service coordinator ensure that services are set up in the community for when the participant transitions. We can make a referral to our behavioral health coordinator who can help coordinate that connection to outpatient therapy in the community. And I also wanted to mention substance use supports. So oftentimes if you have an individual who has substance use concerns and are in the facility, oftentimes they're able to maintain sobriety because the nursing facility has their established rules. They also have a very structured treatment and structured schedule and environment. However, those supports are often needed to maintain sobriety once those facility rules and that structure are no longer provided, once the individual transitions to the community. So the CHC plan can work to coordinate those connections to various substance use services and to informal supports that may be available in the community to help the individual maintain their sobriety. I do want to mention about substance use supports that due to the sensitive nature of substance use, the plan needs to have an updated consent so that it will allow us to discuss those needs with the nursing facility and with any other invested parties. Thank you.
Thank you, Sarah. And once again, this is Kelly, and the question and answers, again, to think about is, would your nursing facility like assistance in accessing behavioral health services or identifying behavioral health providers? So again, if you could put your thoughts or questions in the chat, would be greatly appreciated. And now we come to what I would refer to, I guess, as the meat of our presentations, the highlight of the whole idea behind this webinar is we actually have some providers, providers and nursing facilities that have special programs that they've worked with our behavioral health managed care organizations. So with that, I am going to turn it over to the English here, and I'm sorry, I'm having issues with my laptop. So if Joe, I believe you're going to introduce Diane.
Correct. Thank you, Kelly. This is Joe DeMayo again from Philadelphia CBH, and it is a privilege and an honor to introduce a person who has worked very closely with CBH and who has been an advocate of behavioral health services for this population. Throughout the beginning of Community Health Choices, we've had many conversations and many discussions about the best behavioral health care that we can provide. And Diane has always had great ideas, in such that she was able to develop a peer program, which she'll discuss today as well, which has been very successful. So without further ado, I want to introduce Diane Roth, President and CEO of Inglis in Philadelphia.
Thank you, Joe. And with me today is Paula Burnett, who is one of our certified peer specialists. So we're going to kind of tag team this. I will be really quick. I think I gave too many slides for the presentation, but just as context, Inglis is an organization that serves people with very complex disabilities. And so our skilled nursing facility is Inglis House. And we also have affordable, accessible housing communities and a whole arm of community-based services. And that's relevant because we're going to focus in on today's conversation on our Journeys program, which is our certified peer specialist program. Next slide. That's us. That's our campus. Okay. And just really high level, Inglis House is licensed to serve 252 people. It is currently, we have only people who are who utilize wheelchairs for mobility, and we serve a particularly younger population than most nursing facilities. So our median age is 57, but we've had people who, we just had someone celebrate her 50th anniversary with us. So people have really stayed a very long time for the most part. And our population is approximately, 35% of our residents are people with multiple sclerosis. And then about another third will be developmental disorders such as cerebral palsy and spina bifida. And then the final third are people with spinal cord injuries and other traumatic causes of paralysis. Next slide. What's interesting, when we pulled the data a few weeks back, of our then current 169 residents, 85% have a documented behavioral health diagnosis. And depression and anxiety have been the most common. I think probably that's true for most facilities. What's interesting is that that was pretty much the percentage prior to the pandemic. I think we've seen more exacerbation of the symptoms, but it's been pretty widespread all along. 40% of our current residents have 3 or more active mental health diagnoses. Next slide. So we early on really focused on trying to, before CHC came into play, we really recognized that we had unmet behavioral health needs of our residents. And because we get to know them so well and they are such a kind of empowered population, we just felt the need to provide some services on staff. So we have a licensed clinical social worker, and our director of social services also has a strong behavioral health background. We also contract now with, since CHC has started, with additional external clinical consultants, but now they accept Medicaid. Prior to CHC, most of those consultants did not accept Medicaid. They were Medicare only. So now we have, through CBH, coverage for psychiatry and psych NP services, mostly for the medication management. We also have mobile mental health services that provide psychological assessments, and when necessary, under very special situations, we will go out and do private pay for specialized assessments, because they're so critical to making sure that our person-centered care plans are really person-centered and effective, both for the individual as well as for the team. And then before the pandemic, before Community Health Choices started in the Southeast region, we developed a program called Journeys, which is a community-based mobile certified peer specialist program that specializes in serving people with both a mental health diagnosis and physical disabilities and or chronic illnesses. It was not specific to an age group except over the age of 18. But what we did believe at the time that we created the program, and I think it's proven true, and Paula will talk about it, is that we really saw the need for certified peer specialists for both people who live in facilities and people who live in the community, but particularly those who are moving from one setting to another. Next. Yeah, so I think I'm going to turn this to Paula. Many people have talked about certified peer specialists, but I think Paula, as an truly extraordinary long-term peer specialist, might be best to talk about what the services of a peer specialist include.
Good afternoon, everybody. I'm Paula Burnett. I am a certified peer specialist. And being a certified peer specialist is for someone to have someone who walked a similar path as they may have walked. I know for this particular population, especially in long-term care and those with chronic illness, it helps to be able to get peer support, someone who also had a personal lived experience with it. Like some of the folks I work with or participants get shocked when I told them for 2 years I couldn't walk, and they were like, "What?" I said, "Yes, for 2 years. The blessing is I'm able to walk." So I do know how to feel like not to walk. I know what it feels like to feel lonely. I know what it feels like to feel as though that no one might not understand what's going on with you at the moment. And since the pandemic, peer support has been really detrimental to this, especially for those who transition from long-term care into the community, because some folks do not have the informal support system as others. So I look forward every day to do what I do and to help others in need. We there as a hand up. Thank you.
Thanks, Paula. Can you tell, kind of even without identifying anybody, a story of someone who you have been working with in the facility and then helped them as they transitioned out?
There's one particular individual that I'm thinking of, and this individual would be great to become themselves a certified peer specialist, be peer support. Someone who transitioned from English House was able to already have their services, their behavioral health services already set up, already utilizing the behavioral health services. And not only are they utilizing it, they're actually going more out in the community. They go to another county and have meals. I mean, it's just amazing. I tell this individual sometimes, almost every time I meet, and say, I want to be just like you when I grow up. Then, yeah, I mean, you can't beat that.
Right.
At all.
Thank you, Paula. I think we can go to the next slide. Yeah, just as data, we transitioned, or we were focused on transitioning people from English House to a new apartment building that we had just been opening last November. In early 2021, we had identified 29 residents who had been interested in independent living. We engaged a very intense team process to prepare residents. Through that process, 5 residents successfully transitioned, but we got a lot of learnings out of that. And really, it goes back to what Sarah has said and what Paula just echoed, having really good assessments up front and having the behavioral health services in place before people are transitioning out is really critical to the successful transition. Next slide. Yeah, I think that just what I said. And then from our perspective and the team at English House, we believe that of our training needs, our staff would be best served by mental health first aid and trauma-informed care trainings, because it's really important for everybody to be tuned in to the signals that someone might need behavioral health services, and that's among both staff and residents. And so creating an environment where people are getting the help they need is important for the whole organization. Thank you very much for having us.
Thank you so very much, Diane and Paula. I'm going to keep it with you, Joe, and if you can introduce the next presenter.
Sure. Everybody, the next presenter I want to introduce you all to is Tara Winter. Tara was the vice president at Genesis Healthcare at one of our nursing homes in Philadelphia called Chapel Manor. And we worked very closely with Tara in a couple of innovative programs that CBH and the city of Philadelphia developed, one called the Peace Program. So Tara's been an advocate, again, a strong advocate of behavioral health services for residents in long-term care facilities. So without further ado, I'd like to introduce you to Tara Winter.
Hi, everyone. My name is Tara Winter, and I am a licensed nursing home administrator and the former nursing home administrator at Chapel Manor, which is located in Philadelphia, Pennsylvania. I had the opportunity to work with CBH and the PEACE program. And what the PEACE program was, it was a program initiated by the city of Philadelphia to assist older adults who live in Philadelphia in housing that was city supported. The goal was to move these individuals to a more appropriate setting to ensure their safety and an appropriate level of care. And these settings included nursing facilities. So I was able to become a partner of the PEACE program with the support of CBH. And the residents that were referred through the PEACE program and are referred are potentially could have a history of being homelessness and or having a mental health diagnosis. These individuals were also primarily Medicaid residents. And in order to support these individuals, we had initiated an emotional health and well-being unit. And the CBH and the PEACE program, they were able to provide additional services, which included crisis management training and mental health first aid training for all the staff. CBH was also able to provide additional psychiatric and psychology services to support the population that we were taking on. And I think, you know, the most important takeaways from these speakers and this call are that nursing facilities are not alone when it comes to managing patients with mental health diagnoses, behavioral challenges. The behavioral health managed care organizations have plentiful resources that all nursing facilities can utilize. And I think it's important for nursing facilities to realize that, you know, they're not just a vendor or provider, they can be your partner in the management of these patients that have potentially challenging behaviors or mental health diagnoses. Thank you very much for having me.
Thank you so much, Tara. I'm going to now turn it over to Lauren Keane to introduce Jessica Peacock.
Yep, thank you. So as I mentioned earlier, in an effort to increase some behavioral health supports that are available within nursing facilities, Magellan looked towards peer specialists as a service previously not often utilized in nursing facilities, and therefore we saw this as an opportunity to enhance already existing support. So Magellan started engaging some facilities last year to assess for those interested in partnering with us in these efforts, and we are lucky to have a great partnership in PeerStar, who provides peer specialist services. So we were a bit challenged with COVID, you know, with being able to actually go into facilities and also just in general staffing challenges. But we have a solid footing right now and looking forward to moving forward with these partnerships. So I will go ahead and introduce Jessica Peacock to explain more about these certified peer specialists and how they can work within nursing facilities. She's the Director of Recovery and Community Outreach at PeerStar.
Thank you, Lauren. As Lauren just mentioned, this is, well, peer support is not new, but our collaboration on trying to really engage the nursing facilities is something that we are really piloting. So before I get into what that pilot program looks like, I wanted to just give some general information about peer support. I have been working within the role of peer support for about 10 years now. I had worked with children and then moved to adult services. And in those 10 years, I have found that peer support is still really a hidden gem that many people do not know about. So just to give you a little bit of information about what peer support is, you can see here on the slide, it's non-traditional mental health recovery support. What in the world does that mean? When people think of mental health treatment, they often think of psychiatry or counseling, therapy, and peer support is different, as in it's not treatment, but it's actually support. It is mentorship, it is guidance, it is really a recovery, a mental health or substance use recovery focused support program. So it's really based on the foundation of inspiring hope. It's amazing and refreshing to actually read literature that uses the word hope in it, which is not the typical medical model approach to mental health that historically we've used in our country, but in peer support it is. So peer specialist, as Paula mentioned that she is a peer specialist. You know, the primary role here is inspiring hope in others that recovery is real, that recovery is possible, you can feel good. And it's coming from someone who has experienced those struggles themselves and has learned how to really manage and maintain their wellness. So peer specialist and peer support in general provides encouragement to others. It guides mental health recovery, as Paula mentioned, walking beside somebody, using their own lived experience to say, hey, I've experienced these struggles. This is what worked for me. Now let me help you find what works for you. And then honestly, using that experience to model and teach wellness strategies. You can go ahead and go to the next slide. Peer support can do multiple things, as Paula mentioned as well. One of the primary things is developing and implementing recovery plans. So although that sounds very formal, and you know, most organizations, we are going to tell you we do have a very formal process for creating those plans, but it's also very informal and very relatable to help somebody just start to talk about feeling good and just start to talk about what their future could look like. You know, we really work with people to find out, you know, in their current situation, what are their hopes and dreams? How can we help them live their best life in the reality that they are experiencing? This could be, you know, helping them create plans for managing crisis situations, you know, so that they can learn to prepare for a crisis, you know, a psychiatric crisis situation that could occur, and then how to get, you know, gain those coping skills to learn to manage that. Helping them build community and natural support systems. So again, natural support systems are those people that can be with them at all times, or that they can reach out at all times. That might mean connecting people to helplines. That might mean helping them build relationships within the nursing facility, or even, you know, rebuilding relationships that maybe they haven't had in years. We can do a lot of that connecting. Finding community supports that are available to them. Helping individuals with individual advocacy, promoting personal responsibility and empowerment. That's a huge part of peer support, is helping people recognize what control they have over their situation and helping them learn how to advocate for themselves in a way that gets their needs met, but also, especially in a nursing facility, also meets the needs of the nursing facility and meets the roles and guidance of, you know, the reality of being a resident at the nursing facility. We work on helping people develop their self-confidence and develop their self-worth, helping them, you know, again, I mentioned living their best life, finding who their best self is and having their best life in the current situation that they're having. You can see here, we really focus on overall wellness and life satisfaction. It's about feeling good. It's about feeling well. It's about finding happiness and joy. And then the last part here is, you know, building those connections. I already mentioned about, you know, trying to find connections in a nursing facility, but a lot of nursing staff that we have talked about have said that a lot of individuals that would benefit from peer support are those residents that are looking for personal connection. They're the residents that don't have visitors. They're the residents that don't have someone to call. They're the residents that don't have hobbies or don't have activities that interest them. Those are all things that peer specialists work to help these residents find. They spend that time to help them find their interest, and how can we use that interest to improve our wellness? How can we, you know, find people to connect to and build those relationships with? You can go ahead and change the slide, just to give you some of the basic information on eligibility, because again, most people don't know about this service because it is primarily funded through Medicaid, not through private insurance. So I know many of us know about services based on what our own insurance would cover if we needed it. But Medicaid is the primary funder, especially for our services at PeerStar. We provide services currently in 27 counties in Pennsylvania. both in the home setting and in the community setting. As we'll mention here, the pilot program is in a nursing facility, but what's nice is if some of those residents would be transitioning out of that nursing facility, we are able to transition with them into the home and community setting and help them, with those goals of living independently, finding housing, those kind of things as well. So your eligibility, adults 18 and over. So we're going to talk about working with older adults, but we can work with anyone 18 and older in a facility or outside of the facility that is Medicaid eligible, and that also has a mental health diagnosis with a functional impairment. I always say that functional impairment means that their mental health diagnosis is really impacting their ability to live, laugh, love, and play. And then the last thing I have here, just because we will talk about older adults, is they have to be able to be cognitively able to engage and participate in our services. Our services are not just companionship. We actually, do work on, goals and again, those wellness strategies and things like that. And we have had some difficulty in the past with individuals who, their dementia or Alzheimer's is, has progressed to the point that they can't actively engage in the actual peer support services. I personally have acted as a consultant for that. When we do have a client that is starting to show those symptoms, I will go in and do a clinical consultation. Peer support is not clinical. However, we do have clinical people like myself to provide that additional guidance when we have those kind of situations. So if you would move to the next slide, I'm almost done here. What I wanted to mention is this pilot program that Lauren and us have, that Magellan and PeerStar have really partnered with. And this was acknowledging, again, especially with COVID, I mean, this has always been a concern, but COVID really brought out the concern of isolation and of individuals who do not have someone to connect to, and, the behavioral health struggles that everybody was starting to recognize. I think we all were probably experiencing some mental health and behavioral health struggles that maybe we haven't before because of COVID. So in this Empowered Aging Peer Support program, what we have done is we have developed a very specialized training for our current staff. Just so you know, certified peer specialists in the state of Pennsylvania have to go through a 10-day certification training through a vendor that is approved by the state. They actually then get certified through the Pennsylvania Certification Board. So it is they're very dedicated individuals who have gone through a training process to even begin working in peer support. And then what we have done is we have created this additional training that really focuses on older adults, and we've called it Empowered Aging Peer Support. So our staff receive this additional training on normal aging. We go through all of the aspects of normal development, lifespan development in the aging process. We talk about the transitions, the life experiences that older adults have. And then we really talk about unique circumstances and challenges. We talk about loneliness, isolation. We talk about grief, bereavement, the loss that occurs, not just the loss by death, but the loss of physical ability, the loss of, purpose. A lot of people have struggled with purpose as they age. We talk about unique circumstances of transitioning from independent living to assisted living to facility living. Those are all things that are discussed in this training. We talk about cultural competency. I know the term ageism was used earlier in this webinar. We go over that, and we also go over understanding how the time that somebody grew up can impact the way they talk and the way they think now, and so that our staff are prepared for that. And then we really talk about the specific strategies for supporting aging adults. One of the really cool things about this pilot program is that the staff that are going into the nursing facilities are, although they're coming in as an outside organization or an outside, agency, we are being oriented with the facility. We have, we're requiring meetings with the facility, administrator, someone who can sit down and give that staff member an orientation to the facility. So the staff member is familiar with, the areas that residents can access, the areas that they may need, permission to access. That our staff member is given the information they need to be successful and to be a partner in each facility that we go into. And that way the facility gets to know the staff member and the staff member gets to know the facility. that we're also able to kind of, really work with that facility to identify what peer support goals and activities can truly and most beneficially be provided in that facility. And so each facility we are going to be able to work with, we can really kind of work to be individual and specific to the needs of the individuals in that facility and what's available in the facility. So that's all I have, just to give you that information. I just included my contact information on here in case you would have questions. Like I said, we are in 27 counties in Pennsylvania, so you're welcome to reach out and contact me if you have any questions. And again, Lauren, thank you so much for Magellan's partnership. We are excited for where we're all going in the future with facilities.
Yeah, I agree. We feel the same. So, all right, thank you.
Thank you, Jessica. Thank you for that presentation and further explanation of peer support services in the community and how they can be utilized in nursing facilities. Duncan, I'm going to turn it over to you to provide an introduction to Stacy Williams.
Great, thank you, Kelly. So I'm going to take a few minutes to review a new program, and then I'll pass it over to Stacy, and she'll give some information about what it's actually like to work with the program. So just a little bit of background. If you remember earlier this afternoon in the presentation, Joe talked about some of the behavioral health services that are available, and he talked about the state in-plan services, which all behavioral health MCOs have to cover. He also mentioned supplemental or in lieu of services. So this program that I'm going to talk about is one of those supplemental programs. So I just wanted to sort of mention, because it's a supplemental program, it's only available in Allegheny County for Allegheny County residents. So the program in question is called New Connections. And I'm just going to give you a little bit of background on it. So really one of the goals of the program was to provide or create an innovative behavioral health service for nursing facility residents or those who are nursing facility clinically eligible, and really to support the Community Health Choices program. We know that older adults and folks in nursing facilities have often complex needs. So the program was sort of designed to really be able to attend to behavioral health, physical health, and social determinant of health needs, and really support people in a nursing facility who have behavioral health needs, but also assist folks as they may return back to the community. A couple of different things that we hope to also sort of get out of the program was that one, recognizing that sometimes the behavioral health needs in nursing facilities, sometimes can be an underserved population. So hopefully, offering another type of behavioral health treatment. Also hoping that by having a program like this, which is sort of embedded in a nursing facility, you might be able to decrease sort of people going inpatient for psychiatric reasons because you have support there in the facility. Also hoping that a program like this that can support people as they transition back home might decrease sort of folks possibly being readmitted to nursing facilities too. We really wanted to support that transition back to the community piece of it. As you'll see, that the program has a psychiatric consultation piece of it, and again, hoping that this program would increase the amount of psychiatric consultation that takes place within nursing facilities. Those are really some of the goals of the program. The population that the program will serve is really anybody 18 years or older. They have to have a serious mental illness, and again, you have to be nursing facility clinically eligible. The program itself is actually a team-based program, and it's got four main components to it. It has a psychiatrist or CRNP, who acts in the role as a consultant. They're not prescribing medication, but they can be a consultant to the team or to a nursing facility and their medical staff. It has a mental health professional, which is going to be a licensed mental health professional in the state of Pennsylvania. There is a nurse on the team, and there's a certified peer support specialist. And it's actually nice that the two prior presentations really did a really thorough job of describing all the benefits and the great things that peer support specialists can do. So a peer support specialist is part of this team. So the team is made up of the four folks that I just mentioned. The intent of the program really was to be kind of embedded in a nursing facility so that residents who need the behavioral health supports of this program could easily and quickly access them. The program obviously was sort of hampered to some degree when COVID came around, because we all know that nursing facilities were particularly challenged by COVID and had to sort of close doors. And so it took a little longer than expected to get the program up and running, but it has actually been operational now for about a year. There are 2 teams or 2 behavioral health providers that run this service. And again, it's for residents of Allegheny County, so it's all within Allegheny County. They really are working on site with nursing facilities, and Stacy Williams is actually going to talk about what it's actually like to have one of the teams working with her and her residents in their facility. So Stacy is from Keane, the Keane Community Living Centers. She's from the Scott facility. And I'll hand it over to you, Stacy, to give sort of a little bit more detail about what it's like to work with the program.
Thank you, Duncan. Good afternoon, everyone. So as Duncan said, New Connections was presented to our facility. We are a county nursing facility in Allegheny County. And New Connections, even though it was slow in getting started, has been very beneficial to our nursing facility. New Connections came into our facility and met with our staff, residents, and families to see how they can assess all to help manage the residents' behaviors. This has been, again, very beneficial program. We have seen a decrease in the behaviors of our residents, and they often look forward to meeting with the New Connection team members. We currently have 6 residents followed by New Connections. In addition to coming into our facility, they offer discharge assistance for those planning to transition back into the community regarding their behavioral health needs. I would recommend to any facility looking for behavior support to partner with any of the BH, as you heard on this presentation, the MCOs, and the providers. It is a great support to the residents in our facility, along with developing a resourceful partnership. So that's all I have to give on New Connections. As you can see on the slide, it is a process, and it is a very helpful program. And even though it's in its infancy, about a year, I'm looking forward to seeing where it's going to go in the next couple of years, especially further than Allegheny County. Thank you for allowing me to share this information with you this afternoon.
Thank you very much. So again, thank you to all the presenters from the providers and the nursing facility associations and nursing facilities on your presentations, because again, I think this was the whole purpose, so that everyone could not only learn a little bit more about behavioral health services and how to access them, but what thinking has gone outside of the box to provide services for individuals. So with that, we're going to turn it over to C. I'm going to see if there has been any questions or comments posted in the chat.
It looks like we do have some questions that have been shared in the Q&A box. I'll go ahead and share those with the panelists, and we can open things up for the Q&A. One of the questions that was asked is, what behavioral health services are available to long-term care residents who do not receive Medicaid?
The services that, again, we are presenting are those individuals that either have, dual eligibility with Medicare or Medicaid, or just Medicaid. They would, if they are not covered by any medical insurance, if it's a commercial plan, they would need to work with their commercial insurance coverage on any type of services that'll be available to them, or check in through the county. Where the individual nursing facility resides, to see if there happens to be any other behavioral health services available to those individuals that may be either underinsured or not insured at all.
Okay, the next question, will the behavioral health MCOs be setting up calls in their respective regions to review their services?
I will turn this over to the behavioral health coordinators to see if they plan to do this or can plan to do it, or just contact information maybe to do this individually. I'll turn it over to them.
Hey, Kelly, it's Duncan. I could just speak for community care behavioral health. Yeah, we'd be happy to do that. I'm just wondering what the most effective way to do that might be. I could definitely leave my contact information if that's helpful, but yeah, we'd be happy to meet with folks.
Yeah, I would say, in agreeing with Duncan, I think we're always happy to have those conversations. And again, we've been trying to make outreach calls proactively to have those discussions, but certainly welcome, any facilities interested in contacting us, and we can have those discussions for sure.
Hi, this is Joe from CBH in Philadelphia. To the 47 nursing facilities in Philadelphia, we've recently sent out a behavioral health survey to all the administrators. So hopefully they've all received that and answered it and sent it back to us, just on ideas of what services they would like, if they're interested in developing any new services. In Philadelphia, we plan on developing some innovative behavioral health services for nursing facilities, and we just wanted to see if anybody was available for participation. So we've also sent out a lot of training opportunities. So hopefully we've received those surveys back, and we'll reach out to you.
Great. So we have another question. Psychiatry services in Western Pennsylvania were limited at best pre-COVID. Post-COVID, they are even more limited. Most nursing facilities may not have a psychiatry provider, and if they do, it's via telehealth and done monthly. What do you have to offer in this area for psychiatry?
This is Kelly, and I will let Duncan Bruce and Rachel Lee Price, they represent the managed care organizations in the western part of the state. But I will say, agree that psychiatric care, seeing a psychiatrist before the pandemic, it's unfortunately a national crisis situation with the lack of psychiatrists, especially geriatric psychiatry, and the pandemic made this worse. A lot of our behavioral health services since the pandemic are now offered through telehealth. It should still be available in person, however, for those individuals that do not like telehealth. But we know that with the Great Resignation across all lines of work, that is even, and especially in human services fields, we know that there's a lack of staff. So with that being said, I will let them speak. But I also wanted to note before I forget, that Olivia Martin and Dan Eisenhower were actually on the call today, but did not receive the proper links to, they're muted and they were not able to participate. So I did provide Dan's email information in the chat box. So if anyone would like to reach out to him, that in performed care counties that are covered, which would be Franklin, Fulton, Dauphin, Lancaster, Lebanon, Cumberland, Perry counties, please feel free to reach out to Dan. So with that, Duncan, Rachel, if you all have any information about psychiatric services.
Sure, Kelly, it's Duncan. So just to sort of quickly mention that unfortunately for the vast majority of folks that are dual eligible Medicare, Medicaid, they usually have to go through their Medicare plan first for psychiatry. But I will say just a couple of things. What we're sort of trying to do, definitely increasing the usage of telepsychiatry is something that's beneficial. The program I just mentioned, the New Connections program, that has a psychiatric consultation piece of it, so that if you have a PCP or other sort of medical specialist, they can actually sort of consult with that person. So sort of alleviates the psychiatry piece a little bit. We often, or for quite a while, have been encouraging models like collaborative care, which enables PCPs to manage psychiatric needs, which sort of frees up some psychiatry time too. We do, our psychiatrists that we have at Community Care too, they will, take a call and sort of have a discussion with other sort of medical professionals as well if needed. They're not acting in the true role of a consultant, but they're definitely willing to talk with folks and hopefully assist in that way as well. So I know we've only got a minute left, so Rachel, I don't know if you have other stuff to add.
All I wanted to add is if there is a need of a specific nursing facility and we find out about it, we can help coordinate with the providers located in the county. The outpatient clinics may not be aware that there's a need, so it may seem like it doesn't exist, but we can help facilitate that communication and see if we can get some providers to go to the nursing facility. Thanks.
And thank you. And this is Kelly. I do want to thank you, Duncan, for again bringing to the forefront, especially those individuals that are covered, have primary coverage through Medicare. You will need to work with the Medicare provider first before Medicaid. But the behavioral health managed care organizations often do know of those different providers for all levels of care that also accept Medicare. There are a few services, such as certified peer specialists, that are not covered by Medicare. So since that is not covered by Medicare, Medicaid will be the primary payer for peer services. And since we only have a minute left, I don't know if we want to address other questions, maybe through email or how many there are, but I do want to be cognizant of the time that everybody has.
Sure, and we can send those questions out to the group. Again, I want to thank our presenters for sharing this important information today, and thank you all to our attendees for joining us on today's webinar. As a reminder, we'll be hosting this webinar again on Tuesday, May 3rd. So if there are others who you know that might benefit from this discussion, we encourage you to share the details with your colleagues. Registration is available at phca.org. We'll also make today's webinar available on the PHCA website, and we'll be sharing it with OLTL, LeadingAge PA, and PHCA. If you have any questions, please let us know. Thank you again, everyone. Take care and have a wonderful afternoon.